Hello, and welcome to CommonHealth. My name is Phillip Noel, and I'm your host here today. On CommonHealth, we have conversations that explore how Virginians think about and engage with their health and the health of their communities. Today, we have a very special guest, Dr. Michelle Peace, a professor at Virginia Commonwealth University whose focus is on forensic toxicology, electronic cigarettes, substance use, cannabis products, drug testing, and public safety. And since 2014, Dr. Peace has received support from the National Institute of Justice to study electronic cigarettes, including how these products are used with substances beyond nicotine, and what that means for public health, consumer safety, impaired driving, and communities across Virginia. Today, we'll talk to Dr. Peace about what people think they know about vaping, what the science is actually showing, and what consumers, parents, educators, and policymakers should understand as vaping products continue to evolve. Dr. Peace, thank you for joining us.
Yeah, thank you for having me.
It's going to be so much fun and informative because I think this is a very important topic, as I'm sure that you're fully aware of.
Yeah, well, I definitely appreciate, the bandwidth and the interest to talk about, all the good things coming out of my research lab and, and how we think it's impacting public health and public safety.
Across the entire Commonwealth of Virginia, which is why this is important. So, Dr. Peace, before we get into the research, can you tell us about your journey and how you became interested in forensic toxicology?
Sure. I'll give you the nickel version.
Okay, I'll take it.
I was working on my master's degree at the Office of the Chief Medical Examiner in Baltimore, Maryland. And that was the year of the O.J. Simpson trial. So, which is important because it's a lesson in knowing who you are and what your limitations are. So, because of the trial, I thought I wanted to be a crime scene investigator or a death investigator. So that's why I went to the Office of the Chief Medical Examiner to do my research. And there were a couple of cases that came through that involved babies. And I couldn't stop thinking about it. Like I was having nightmares. And so I'm a chemist by trade.
Okay.
So I was a chemistry major. I did, I worked for a couple of companies as a chemist. So this was, crime scene investigator was going to be a deviation for me.
Okay.
And so once I realized that I might have a problem with that, right? Because you see these cases and as shocking as they might be, like this wall comes down, you just get to work. Yeah. Right, you work the protocol. And with these two babies, I couldn't. I was so upset by them. And so I went to my supervisor and I said, I really think I need to try something else here in the facility. And he took me up to the toxicology lab. And so toxicology is analytical chemistry at its heart. And so when I walked into the lab, I'm not even kidding you, it was like the heavens parted and the angels sing because I was back to being a chemist. Yeah. So that's how I became a forensic toxicologist.
Amazing.
And so the chief forensic toxicologist for the state of Maryland is Barry Levine. And he came to me at the end of my research and he said, I really think you need to go work on your PhD. So I came down to Richmond to VCU and I worked with Dr. Alphonse Poklis, and who is a world-renowned forensic toxicologist. Yeah. And so that launched my career.
I think that's why it's so important to ask about someone's journey because sometimes it's never straight.
It's never straight.
Right. It's this direct line. And so what drew you to the work that connects science, substance abuse, public health, and public safety like your work currently does?
One of the things that I think is particularly interesting about forensic toxicology, well, forensic science in general. Yeah. So as a chemist, I think about how do I leverage the tools that I have to answer these unknown questions. And so what was interesting for me about toxicology was that it's also biology. So once you figure out what the drug or the poison is that the person has ingested, consumed, however they take it, or somebody has given it to them, then the question becomes, how did that substance, did it precipitate death or impairment? Did it contribute to it, right? So you have to know how that drug acts in the body. So those two things together, the analytical chemistry piece and this application to how do drugs and poisons impact somebody, that was me solving problems and answering questions at a molecular level,
Yeah.
which resonated with me. And I think the third piece of that is being able to talk about those things so that people can make better choices in their lives. And, I'm from the Midwest. I'm pretty plain spoken.
Yeah.
And, when you can break down something that is so complex about analytical chemistry and how chemicals act in the body to help people make better decisions, then you have to do that in a way that it empowers people to make a better decision.
Yeah.
So those three things together really are what keep me in this space of public safety, public health, empowering people to make better decisions.
So like research just wouldn't in itself just not be enough for you. You want to actually have a hand in the solution finding, the implementation of solutions.
Yeah, absolutely. I knew, I'll be honest, I was not a great chemistry major.
Yeah.
Because, in a lot of ways, when you think about organic chemistry or physical chemistry, those are very, very complex and felt very esoteric for me. I don't know how I'm going to use that information. And so I was always searching for a really practical way to apply chemistry. So I did actually, before I went back to work on my master's degree, I worked for a major company, international company, Procter & Gamble, as a chemist. And I was using chemistry to essentially invent new materials for a more absorbent diaper.
Gotcha. Okay.
Right?
Yeah.
Very practical application for chemistry, right?
Right.
And that was fun and interesting. And I have 3 patents with the research team that I was working with there. And it was exciting, but I couldn't stop thinking about this applying science and applying chemistry to make people's lives better in these richer ways.
Gotcha.
Yeah.
I love that. And I think that this sets an amazing foundation for what we're here today, and that's speaking about electronic cigarettes, right? Yeah. So when did electronic cigarettes first come onto your radar as something worth researching?
Yeah. So it's hard to put a pin in exactly when it transpired, but I would say probably around 2012. Okay. I would like to think that I was struck with this great idea, but it actually came from an undergraduate student. Yeah, who she had been studying abroad in Europe. She comes back from Europe and she's my advisee and she's just there to get back on track. She'd been studying abroad and she wants to graduate on time. So we're just, I'm just helping her get her schedule back on track. And while I'm pulling up her records, she says, Dr. Peace, you really need to look at these things called electronic cigarette or vapes. Yeah. And I was like, I have no idea what you're talking about. Yeah. So she keeps talking about how it's very popular in Europe. And I was like, so I pull up Google.
Right.
I'm like, all right, what is she talking about?
Right. Mm-hmm.
And so at the time, it was really about the consumption of nicotine. How do you consume nicotine? Another tool to take nicotine. And I told her, I was like, oh, it's just nicotine. So I looked at her and I was like, why should I care about how people are consuming a legal substance like nicotine?
Right.
And so she keeps talking about it. And I was like, I'm a forensic toxicologist. And that is a legal substance. And nicotine has been around for a long time.
Right.
And we know what those issues are. Yeah. And sometimes I'm a little bit of a slow thinker. So it took me a while to come to the realization that, wow, these are tools. These are discrete devices that if we can figure out how to open them up, people are going to put other substances into them. And so I reached out to a handful of colleagues and asked them, they were, working in crime labs. And I asked, hey, is anybody seeing these in the labs? Are police turning them in as evidence? And almost universally, the answer was no. Okay. Except for one lab, and it was the last lab, right? It's always the last one, right? It's the last place you look. Right. Yeah. And he was like, yeah, we do have a few. And they're not significant to the case. So we have a box of them here. Do you want me to open them up? And I was like, yeah, that would be very helpful. So he did. He calls me back about a month later and he goes, you know what? They have weed in them. And I was like, what? I knew it. I knew it. Right. I knew it. Right. So that was the preliminary data that we used to pitch to the National Institute of Justice that we need to be thinking about these devices in a different way.
Right.
Yeah.
And to that point, what did most people think these vapes were mainly used for, and how different was that from what you were starting to discover? Because, like you said, that they were finding ways to put other things in there.
Yeah.
Maybe did you find that out very early on?
Yeah. So we started reading drug user forums because those exist that tells people like where to buy illicit drugs, how to use them, what dose to take.
Yeah.
It's all really bad advice, but nonetheless, there's several really popular websites. And so we started noticing that there were threads talking about vapes and electronic cigarettes. So we thought, oh, we're onto something. And so while we hadn't found anything yet that had another substance in them, we thought, well, we need to figure out what the device is itself. How does the device itself work?
Yeah.
Right? Because Joe Q Public is still thinking about them as this device to consume nicotine.
Yeah.
And so in this path to like figure out how the devices work and how do we take that liquid and how do we analyze that? We started comparing our results to what were on the labels.
Okay.
And they were vastly different.
Right.
And we were like, this is a problem. There are some products that are more than 100% off the label.
Wow.
And some were 100% off the label in the positive direction where they had double the amount of nicotine in them. Some were, had something on the label and had almost no nicotine in it. So it went both directions. And so then we started monitoring the device itself.
Okay.
Because then we did start seeing the evolution of the device design because people wanted to be able to control the device, right? We are a land of tinkerers. We're a land of invention. And so we did start seeing the device itself evolve to allow the user to change it, put their own coils in it, use their own wicks, put their own e-liquids into it. So we're monitoring the evolution of the device and how those devices work. Why are they exploding? Because there was a period of time that there were lots of devices exploding.
Yes.
And so we were monitoring all of that while also figuring out how to analyze the e-liquid and how much nicotine was or was not in it. And also what are all of the other chemicals they're putting into them.
Yeah.
Flavoring chemicals, solvents, they're using stabilizing chemicals. So we started monitoring that and started creating a database of all of these chemicals that we're finding in just nicotine vapes.
And so if it's not a device that is literally maybe even still within its packaging or something, how do you know that it maybe hasn't already been tampered with by the time you're testing it then?
But it's a good question. Yeah. If it's not in the package, like we will look, like we get in all kinds of products that are not in their original packaging, right? They clearly been used. And we look for clues on the device that somebody's opened it up.
Okay.
And those devices some of them take a little bit of effort to get them open. Okay. So you can find scratch marks and then where somebody's like wedged it open or a clasp got bent. Yeah. Right. That would have been used. So to originally hold it together. Right. So there are clues that indicate to us that somebody tampered with it. But we knew that the language at the time, the Food and Drug Administration refused to authorize these products as nicotine cessation or tobacco cessation products. Okay. That had happened in Europe, where in other other areas of the world where they were being used as tobacco cessation products. Turns out that a lot of people stopped smoking entirely, but you're just switching your habit. So we knew that was happening around the world. In the United States, the FDA said, well, we're not going to allow these to be used as smoking cessation devices. So the manufacturers couldn't advertise that they were smoking cessation tools.
Okay.
Couldn't do it here.
Okay.
And so the industry essentially started promoting the devices as a cultural shift, as a lifestyle choice. These are cool. Yeah. They're healthy. Mm-hmm. They're pretty. They're right. Yeah. There are all of these things. Yeah. They're safe. They're just water.
Right.
Right. So there are layers of frankly, fallacy and myth that developed all the while the Food and Drug Administration hasn't regulated them yet. So you get all of this narrative from the industry that consumers began to trust and believe.
Okay.
And it was way ahead of the science.
Wow.
Yeah.
Wow. And one of the themes, again, of this conversation is what customers think they know versus what the science actually is, right? And so what are the biggest misconceptions consumers have about vaping, in your opinion?
I think really early on, and still today, is that they are a no harm, low harm product. And, whether that is from a lung disease or cancer, or maybe cardiovascular health, or is that it's low harm, no harm. And it's not. So now there is data emerging both out of research spaces and also clinical spaces that is beginning to demonstrate that there are significant cardiovascular effects to vaping. It does cause heart damage.
Yeah.
There is data emerging that it can facilitate cancer growth. There's very good data that demonstrates how the chemicals in vapes are changing the DNA in your mouth, right? And so you change that DNA, you're going to facilitate the production of cells that are going to become cancerous.
Wow.
Or tumorous. So we know that there are now chemicals in the vapes that are causing lung damage. So I think, the early on there was this is safe or safer choice. And now the data is beginning to emerge that that's not necessarily the case.
And we spoke earlier about labels on these products. And so how reliable, in which you've already kind of answered it, how reliable are labels, packaging, or product descriptions on vape products, especially when products are shared, bought informally, or sold through unregulated shops?
Right. So I'm going to take this bite size.
Sure.
So when we think about the labels on the devices, on the packaging, there's very little information about what are all of the chemicals in that liquid that's in the device.
Yeah.
Of course, they're going to have nicotine and what the concentration is. And we've actually learned that in the last few years that we find very few products that deviate from the nicotine concentration.
Yeah.
So that nicotine concentration is pretty accurate. And then you might get that there's propylene glycol and vegetable glycerin, or PG and VG, in the devices. That'll be on the label. And then you'll have this very broad and flavoring chemicals. And so in the unregulated space, which is the majority of vapes that's in the marketplace, we're finding anywhere from 10 to 30, 35 different chemicals in those vapes. In the regulated space, meaning the Food and Drug Administration has authorized these devices, and they've only authorized 39 to date.
So it's way more than 39 out there, right?
Well, I mean, depending on your source, there's 10,000.
Yeah, that's what I'm saying.
Right?
So to hear that only 39 are actually approved by the FDA.
Right. So when we look at the chemical composition of those 39, the chemical composition is much simpler.
Okay.
We might see 5 or 6 chemicals.
Sure.
That's in those products. I have deep concerns. I'll just say it now. I have deep concerns over the most recent news with regards to vapes, right? So one of the reasons why there's only 5, 6 or so chemicals in the authorized products is because in President Trump's first administration, he banned flavoring chemicals in pod-based devices. So those are all of the authorized ones.
Yeah.
So the chemical composition is much simpler because all of those flavoring compounds got banned. And last week, I believe it was, maybe 2 weeks ago, that got lifted.
Okay.
So, so I think that's dangerous.
And to that point, and I want to make sure I'm not overgeneralizing it.
Yeah.
In the first term, so this is probably 8 or so years ago,
Yeah.
that the flavoring was basically, hey, can't do that.
Right.
So does that mean any product that had any form of flavoring prior to this most recent move, legislation-wise, was not one of those approved 39?
Yes.
Really?
Yes.
Wow. And so when we see, all these different flavors, like strawberry, cherry,
cool
blueberry,
raspberry.
yeah,
Yes.
that those are not. That's how
Unregulated.
It's a very quick indicator in your mind of like, okay, that's not a regulated product.
Right. It's not an authorized product.
Wow. Okay. Wow.
Yeah.
And your work has also looked at vaping products among our K through 12 students.
Yes.
Right. And so, what are you seeing that parents and educators really need to understand?
That there's a couple of things we know, and what we have seen, what we hear from teachers and school administrators, is that vaping interferes with successful education. And right, because kids become fixated on it, on acquiring it, consuming it, right, evading the teachers, right, and so there's a subset of behaviors associated with that that's very disruptive in the school systems. So we know that much. In terms of the health of the child, right, so I would say of the thousands of products that we have analyzed over the last 3 years, I think we've only had one device that was an FDA authorized device.
Okay.
So that means that children are inhaling all of these chemicals.
Yeah.
And it is causing lung damage. It is causing the development of excess mucus, right, where the kids feel hacky or coughy. It is causing cardiovascular problems with children, right? There's a couple of published clinical observations where a child had a cardiovascular event at school that got tied to vaping.
Okay.
So there's very good data that demonstrates that that when you compare young people who vape versus those who don't vape, the ones who vape are physiologically 13 years older than their peers who do not vape.
Yeah.
Right. So we're beginning to see a pretty significant impact on their physical health. That mental health problem of now you have a young person who is addicted, who is, in that behavior of seeking the drug, that is disruptive, right? So you have physical issues and mental health issues surrounding these products in the school systems. We try to let people know, like we will provide bulletins that say, these are all the chemicals that we found in the vapes in this last cohort.
Okay.
And we have found a chemical that is fingernail polish remover.
Okay.
It is in very low concentrations, sweet.
Sure.
But we find it in high concentrations.
Yeah.
We have found a chemical that is used to clean brakes. Mm-hmm. We have found formaldehyde. We have the chemical compounds that are we call the degradants. They hit that hot coil and they break apart. They break apart into cancer-causing chemicals, and so your children are inhaling these.
Right.
So,
for minors as well as adults, like hypothetically, let's say that on the actual packaging, that these ingredients are actually listed there, right, as is. Do you feel like that would be even a culture shift, even if they did know the true realities there? Do you feel like people would still be using these things at a high rate?
I think that when you're transparent about what is potentially in them, then you can make a better decision about that. Yeah. I think what is really confusing, though, is the industry has said, I essentially call this the original lie, is that they claimed, well, we're only using chemicals that are on the FDA's GRAS list. GRAS is generally recognized as safe, okay? And so that list exists for chemicals that are safe for people to eat.
Okay.
They are not safe to inhale.
Okay.
That's
Sure.
That's the major difference, is these chemicals that they're putting into the products, into the vaping products, are on the FDA's list.
Yeah.
That list exists for chemicals in food.
Sure.
And so when we take a look at the list of chemicals, we associate them to what is called a hazard classification. And I would say 90 to 95% of the chemicals that we have found in the vapes are known irritants, toxins, or carcinogens when inhaled.
Okay.
And that's right. And so there's 2 layers of education that has to happen there. Is that one, these chemicals are not safe to inhale, and it's not the same as eating these chemicals. And that's complicated, but there are multiple layers of education that has to happen there for people to now, if you're transparent about what all the chemicals are, you have to now empower people to understand what those are, right? Because those chemicals that you find in the vape, if you find them in a box of cereal, 2 different things in terms of how they impact your body.
Yeah.
So now you got to educate them that those chemicals that's on the side of the box of cereal, you should not be inhaling.
What even is the benefit? So, and I don't know if you've come across this in your research. When someone is utilizing a vape, an e-cigarette, whatever the case is, what is the feeling that they're getting that they're even willing to possibly take a perceived risk, a risk that they even know is real?
Sure. So first of all, it's a very easy way to consume nicotine.
Okay.
Now in most of the vapes that are in the marketplace now, they are what's called a nicotine salt. So that salt is actually an organic acid. It's usually benzoic acid or lactic acid, that is attached to the nicotine, and it reduces the harshness of the nicotine. So if you let's say
inhaled,
So if you think about people who smoke, they will say that the nicotine creates like this burning sensation in the back of their throat.
Yeah.
Even longtime smokers will say that, and that is they've gotten used to it.
Okay.
So because of that harshness that nicotine in the cigarette is, that's free-base nicotine, essentially. The human body will only accept so much pain, even for that. And so there tends to be some upper limit that smokers, an upper limit of nicotine in a smoke that they're willing to tolerate. Okay. So you put that concentration, you put that nicotine into a vape and put that organic acid on it, that salt onto it, it softens the nicotine.
Okay.
So that means that you can inhale and hold longer.
Sure.
And it reduces that harshness of hitting in the back of the throat.
Yeah.
So that oftentimes means that you can essentially inhale a higher concentration of nicotine. You can do it more frequently, and you don't get that harshness associated with it. So that facilitates your nicotine addiction.
Yeah. Which probably also helps them maybe psychologically in that way of like, hey, I'm not feeling it. So to me, it's like an out of sight, kind of out of mind type experience.
Yes, it is that.
Okay.
The other layer of that after we take nicotine off the table is that the flavors that they put into the vapes do taste good.
Sure.
Right. And so we are seeing some products that are being sold as flavored air.
Okay.
That's a vape.
Or I hear vapor, which to me sounds water.
Sounds
like harmless.
Exactly.
Things like that.
Yes, exactly.
Yeah.
Right. So
cool.
It's cool.
Like,
yes. Refreshing.
Right. Yeah.
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 There are, I've done this, went down many rabbit holes of advertising that currently exists.
Sure.
And they're getting young people to talk about these, and they'll say, it's these are great, these are fun, these are cool, and they'll say, oh, they have vitamins in them. There's not enough vitamin in that vape for you to get your recommended daily allowance.
Absolutely.
Right?
Yeah.
So there's lots of gimmicks that are now layered into this that are attractive. And the other piece is we can't lose sight of the original advertisement, which was that vaping is cool.
Yeah.
And so, when
And
that
safer.
becomes, and safer. And
Yeah.
so kids will latch onto that because they don't have discernment.
Got it. True.
An adult
Mhm.
hopefully has a little bit more
Sure.
discernment,
Right.
but a child does not.
Right.
So,
And just I was thinking a little bit more to the K through 12. Are schools and parents dealing with the same vaping issue they were dealing with 5 years ago?
no.
Okay.
I mean, no.
Yeah.
It's worse.
Mhm.
And so one of the reasons why it's worse is when we talk to some school teachers and administrators, and we'll ask them, because some of the data that exists will say that, well, vaping is reducing in the schools, or vaping isn't that big of a problem. It's about 7 to 10% of, high school kids are vaping. And so I was thinking about that data, and I was asking, because when you talk to teachers and administrators, they are overwrought by the impact of vapes in their schools. And so I started asking, well, if you had to put a finger on a number as to what percentage of kids are vaping in your school, what would you think that would be? And we've gotten everywhere from 20 to 75% of the kids are vaping in schools. That is not 5, 6, 7%. And so I think maybe we're not asking the right question in some of our surveys. Maybe kids are lying when they take the surveys, right? There's a host of reasons as to why the data that's coming out is maybe not accurate. But that data is being used by the industry to pat themselves on the back to say, look what a great job we're doing. Mm-hmm. We're not promoting the kids. No, you are, because guess what you are doing? The reason why the vaping problem is different than it was 5 years ago is because the vapes are changing. And the vapes now, where they've devised vapes that have 30,000 puffs of them, 100,000 puffs in them. Mm-hmm. The industry has said, well, we're selling fewer units. Yeah, you are, but you're selling more nicotine.
Sure.
Because you got 100,000 puffs in that product. Right? So now, so you're facing that problem.
Right.
You're also facing that they're still very, very attractive to children. Yeah. Find them with games on them. They have like little fiddle feeling things on them, like widgets.
Wow.
Yeah, on them that is, a kid will just want to rub their finger on it. Yeah. Wow. We found some devices where the device is a pet, mm-hmm. and the way to keep your pet alive is to puff. Yeah. So there's that becomes attractive to children. And then there's this other piece of it's flavored air.
Yeah.
It's cool. Right. And so I think that the current problem in schools is shades different than what it was 5 years ago. And it's because we haven't figured out how to get our arms around it. And you've got 10,000 unregulated mm-hmm. types of devices in the marketplace.
Surely. Yeah.
So.
And one more question for our students out there, right? When students are caught with vape products, what should adults be asking beyond, where did you get this?
Yeah. So I think after this, how did you acquire it? I think you have to understand the mentality of the child as to why they chose that, because there's a piece of education there that we're leaving off the table. So is there some mythology that you're believing that it's safe or that it's cool, or to assess the level of addiction maybe that child has? Sure. We have heard horror stories of kids' lives being completely destroyed by nicotine vapes, where they were straight A students, class A athletes, and like significantly successful students picked up vaping. Their grades plummeted. They started stealing money and stuff to sell so that they could acquire nicotine vapes.
Yes.
Right. So I think having open conversations with the child about, like, how long have you been doing this? Like, why do you do it? Why is this important? To understand what that culture is like, so that gets at both prevention, like how do we prevent it, but also the educational piece of what are we missing,
Yeah.
And treating that child as, as somebody who made some bad decisions and probably in the space of no education.
Is it true that we're seeing that some of the parents are providing these products for the children?
Yeah, I have received many angry emails from parents who they heard that their products were confiscated and sent to our lab for analysis. And they will reach out and say, I want the product back. I spent good money on that.
Wow.
And, we can't return it.
Of course.
And we've definitely heard from some teachers who have said, at least it's not cocaine, at least it's not heroin, at least it's not, right? At least it's not something else. It's just a vape.
Right.
So, yeah. So
there's an education piece needed there.
Yeah.
That's awesome. This has been an amazing interview. We just have a few more questions here. I wanted to also speak that your current research looks at vaping and roadside impairment evaluations for suspected DUI, right? How does vaping complicate impairment investigations and drug testing?
Yeah, so I think this is probably one of the least thought about issues, and where I have engaged with a number of scientists at the FDA about the nature of the solvents that are in vapes. So we have found like the solvent ethyl acetate. Ethyl acetate is essentially a fingernail polish remover.
Okay.
And again, at low concentrations, it's a sweetener.
Okay.
And so we have, I've worked a case in which somebody failed their breath test for alcohol. Mm-hmm. So they were in a job in which they were not allowed to consume alcohol.
Okay.
And so they got pulled for a drug test, and he failed his breath test. Mm-hmm. And so he's like, I swear I wasn't drinking.
Yeah.
And so they found me, and we got the vape, and we were like, yep, that's got alcohol in it. Well, it didn't have alcohol, it had ethyl acetate in it.
Okay.
And so one of the things that we learned in the process of working that case up was that ethyl acetate is metabolized to ethanol in lung tissue. Yeah. And we hypothesized that because he had been vaping the entire way to his drug test, mm-hmm. and essentially vaped walking into the clinic, that maybe there was alcohol, there was ethanol in his lungs that contributed to that positive breath test. We don't know that.
Yeah.
Full stop. And I told the caseworkers that, I told the attorneys that, like, I don't know this.
Yeah.
But I can't rule it out. Maybe he did drink and it came to work drunk. Maybe he did. Mm-hmm. But at the end of the day, because I could have put my finger on it, the attorneys, it saved his job. And he was told that he could never vape again. So there's that layer. The other layer is that we have found ethanol, alcohol in vapes, some of them in really high concentration.
Okay.
We have found some vapes as much as 30% ethanol. So our concern was, if you're vaping that much ethanol and you get pulled for a roadside stop, right, because you're suspected of a DUI, if you've been vaping that much ethanol, which is an unintentional, because ethanol is not on the labels, you don't know that you're consuming ethanol. So could you fail a breath test from vaping that much ethanol? And so one of the things that we discovered is that if that breath test that you blow into is given within 6 or 7 minutes of you stopping vaping that much ethanol, you could test positive.
Wow.
Right. You could fail your breath test.
Which is probably a shock to some people who
Absolutely.
are going through that, right?
Absolutely. So when it comes to law enforcement, though, here's the interesting piece, is that most law enforcement, and by most, probably 95% of all law enforcement agencies in the country, when they pull you over and before they administer that breath test, they have what they call the deprivation period.
Okay.
So that deprivation period is to make sure that you're not belching alcohol out of your stomach and alcohol is in your mouth because it came out of your stomach.
Yeah.
When you give a breath test, you want to get the alcohol that's in your deep lung tissue. You want to get the alcohol that has come from your blood and into your lungs and you've exhaled it. That's the alcohol you want to measure. And so this deprivation period, like if an officer has his eyes on you and you belch, the clock starts again.
Sure.
Right? Because they want that alcohol to disappear out of the mouth.
Okay.
So,
wow.
Right. So when we're talking about DUI stops, it's probably not much of an issue because the police officer is going to observe a 15-minute wait period before you give the breath test.
Okay.
So they're going to watch you for 15 minutes before they give the breath test. However, breath tests are used in workplace drug testing, drug courts, schools, right? And they are not observing a 15-minute wait period.
I got you. Oh, it's different then. Yeah.
Right? So when we're talking about, those kinds of situations, you could lose your job. Mm-hmm. You could lose your children, depending on what your situation was. Mm-hmm. So I think that's for us one of the biggest issues.
Yeah.
One of the excuses that we heard early on to help people get out of their DUI was that the PG and the VG and the vapes will make the breath test run positive, and it doesn't. So we were able to demonstrate that if there's no ethanol in there and it's just PG and VG and the nicotine, you're not going to test positive.
Okay.
Yeah. So we had to dispel that as well.
Yeah.
For
work.
Yeah.
Goodness, that's important stuff. Though.
Yeah.
One more question here.
Of course.
So if listeners remember only one thing from this conversation, and I'm sure we covered quite a bit, what do you really want people to take away today, especially if they are consumers or have a family member who is consuming?
Yeah, I think that what people need to think very hard about now is that vaping is not risk-free, that there is risk associated with it. And right now, data is emerging that there is potentially significant risk that can be had from just vaping. It is not safe. We don't even know if it's safer than smoking.
Wow.
Yeah. And so I think that's what the takeaway is that you have to be thoughtful about that and be able to take that risk on, and that kids can't make that decision for themselves.
Yeah. Wow. So Dr. Peace, thank you for this amazing conversation. I think this is very informative, and it's about a very important topic today. And so thank you all for listening to CommonHealth, brought to you by the Virginia Community Healthcare Association. We look forward to seeing you again soon. Thank you.
Yeah, thank you. I appreciate it.